Hi everyone, this is Dr. James Lin. I'd like to welcome you for this particular series of presentation on shoulder pain. This DVD is we're gonna be talking about severe chronic shoulder pain and how we are going to handle, what kind of test is going to be available, what kind of treatment protocol is available. Again, this is an informational DVD only. We're here to give you information so you will be educated. So whenever you have a severe chronic shoulder pain, you're gonna know what to do. And when you go to a certain doctor, if they show you X-ray, MRI, you are going to know exactly what's going on. Again, we are here to give you information only. A lot of patients, when they come to me, they have already gone to many doctors. They have gone to orthopedic surgeons, they've gone to their medical doctors, they have taken painkillers, they have gone to physical therapy, they have gone through exercises, stretches, they have gone through acupuncture, chiropractic adjustment, they have gone to massage therapists, and their pain just will not go away. And the shoulder pain gets worse and worse. Or the shoulder pain gets better for 1 day or 2 days, but the pain come back again. Keep on coming back. Or the pain, they move around. Sometimes the pain is here, sometimes the pain is here, sometimes the pain goes down, sometimes it's up. There are running pain. And they get confused and they don't know what's going on. So this is for you. This DVD is for you. It will explain, it will unlock all the mysteries, all the questions you have about anything related to severe chronic shoulder pain. Okay? And a lot of patients, when they come to me, they are left with option of surgery. Because the medical doctor, they have no way of knowing what's going on. They've done all they can. They don't know what to do. And the only option available is surgery. And I want you to know that there is hope. You don't have to do surgery. There are options out there. There are treatment out there that will help you repair all the damages in your shoulder without any surgery. Okay, so bear with me. This is going to be about an hour and a half approximately video. So I want you to stay with me. You are going to get tons and tons of information. I'm very excited for you because you're gonna get so much information. Okay, so why I started shoulder program? Let me tell you about my history. Ever since I was in college, I began to have pain, unexplained pain. The pain would sometimes be in my finger, sometimes my elbow, sometimes my shoulders, sometimes my neck. And the pain, they run. For example, I will have shoulder pain here, and I will have the pain for a week. Severe pain. I cannot lift my hands up. Even with a little bit of lifting, I have severe pain. And I could not sleep. When I lay on the bed, I have pain, especially when I lay on the side, severe pain. And I can explain, I went to the medical doctor, I have X-ray, I have MRI done, nothing helped. And sometimes the pain will last for a week or so. It shifted to somewhere else, shifted to my knee or to my wrist. Sometimes the shoulder pain will last for half a year. And I thought to myself, I'm gonna get disabled. I will not be able to do anything. And after half a year, the pain just goes away. And it will come on and off like that for years and years. Sometimes pain comes back, sometimes it doesn't. Until I start studying. And the more I study, the more I discover the mystery of the shoulder pain. It's not just a physical issue. There's so many issues that is causing shoulder pain. And I will be discussing every single one of the issues that may or will cause shoulder pain, and you are going to learn every one of them. I will be covering in detail. Again, it's going to be long, but stay with me. Okay? So, we're going to start with case studies. Almost every single shoulder pain patient, when they come to me, I require that they get an MRI, an X-ray. And when the X-ray and MRI is here, I will go through the MRI film with them. I will also go through the MRI report with them. So let me go through 3 case studies with you. And I have the case studies right here. Let me show you in detail. Okay, so case study number 1. Whenever you look at the MRI report, this is the MRI report, you always want to go to the conclusion. Conclusion will tell you what's going on with the shoulder. Okay, so number 1, it says here, there is a partial intrasubstance tear of the supraspinatus tendon. Supraspinatus tendon is the most common injury occurred to the shoulder. If you have supraspinatus tendon tear, your pain, you're going to have severe shoulder pain, and you are going to have pain even lifting up shoulder up this high. You're going to have pain. And a lot of patients, when they come to me, their shoulder is going to go up maximum here. And if they want to try to move more, they're actually not moving their shoulder, they're moving their entire body to try to lift them up, but they cannot. Most important, usually number 1 reason is because of the supraspinatus tendon tear. And let me show you what a supraspinatus tendon is. If you look at the picture here, the shoulder, this is the supraspinatus muscle. The supraspinatus tendon goes from the muscle, attaches to the humeral head of the bone here. When you have a tear, it's always here, always here. If it is a complete rupture of the tendon, you gotta go through surgery. Sorry about that, there's nothing that I can do. But 90% of the time, it's not a rupture, it's a tear. Tendinosis, or a partial tear. If it is a partial tear, you do not need surgery. If the medical doctor says you need to go to surgery and repair that, you do not. There are machines that will repair. There are techniques, there are ways, there are supplements, there are herbs that can repair the tear in the supraspinatus. Okay? The next cause of the shoulder pain for this particular patient is number 2 here. Says there is a edema in the subcortical bone adjacent to the attachment of the supraspinatus tendon, which could represent bony reactive changes related to the tendon inflammation. But this could also represent some bone bruising if the patient had direct trauma to the area. Again, whenever somebody has a direct trauma, either through sports, football, or they tripped, they fall, most of the time it's a complete rupture. If it's not, if it's a incomplete tear, usually it's caused by repetitive movement. You're always moving your arm back and forth. You're always lifting things. You're always lifting heavy boxes, and your supraspinatus tendon is always grinding on the bone, which causes tear. And whenever there's tear of the supraspinatus tendon, there's always effusion or edema. Okay, so edema comes from where? The edema and effusion usually caused because the bursa has been broken. And what is bursa? I will tell you that later on, okay? When the bursa is broken, the water comes out. And when you have a tendon tear also, the surrounding capillaries is going to break, it's going to release water as well. So the whole shoulder is going to be swollen. The more swollen you are, the more inflammation you have. The more inflammation you have, if you do not take away the swollen, the edema, and the inflammation, no matter what anybody could do, the repair will not come in place. The tendon tear will not heal. Will not heal. Okay, we're going to talk about inflammation later on as well too. Okay. Number 3, there is a tear along the anterior margin of the glenoid labrum. What is glenoid labrum? This is a glenoid labrum right here. It's at the surface. This is the shoulder here, the surface of the shoulder. Again, when you have repetitive stress, like fixing a car, like carry heavy boxes all the time, it's going to cause tear in the structure, this is mainly consists of cartilage. There are going to have a lot of cartilage tear, and when you have tear, again, could be here, swollen, inflammation, edema. Always accompany the tear. Always accompany tear. Number 4, there is a mild tendinosis of the intra-articular portion of the bicep tendon. This is a bicep tendon. This is bicep. Okay? Now bicep tendon is right here. When you have a bicep tendon tear, you have severe pain right here. And when you have bicep tendon tear, you are not going to able to lift your hand up this way. The maximum pump, okay, so pretend you're in front of TV, okay? Go ahead and do this with me. Up. If you have pain right away, right here, you have bicep tendon tear right away. Now again, if you have any pain, let's say if you lift it up this way or this way, if there's pain right away, then you know that the bursa, there's something wrong with the bursa. Either inflamed, either tear, either torn, whatever it is, there's bursa that's broken. Okay, so different movement, we know will cause, is caused by different tear of a different tendon. So again, this movement represents bicep tendon tear. This movement represents supraspinatus tear. This movement usually represents deltoid muscle tear. Okay, so you learn, so you can identify different muscles group by yourself just by watching what I do. Okay. Case number 2. Impression. High-grade tendinosis. Again, whenever you see a tendinosis, always mean there is some kind of injury or some kind of tear. Tendinosis of the tendon of the supraspinatus and infraspinatus without complete tear. Again, supra and infraspinatus. Let me show you what infraspinatus is. At the back of the shoulder, the muscle, this is the infraspinatus muscle right here. This is the infraspinatus tendon. Very, very commonly tear right here. Tear here, the infraspinatus tendon. Let me show you the movement of the infraspinatus tendon tear. If you play golf, okay, when you do golf, you do this way, right? And you hit the ball, follow through. There are a few patients, when there's a tear right here, infraspinatus tendon, it tears right here. If you do movement this way, it's going to cause a lot of pain just by moving this way. Or if you try to open the door and open the door this way, it's going to cause pain right here because infraspinatus muscle is responsible for this movement or this movement. Okay? Or when you try to pick up something up this way, it's going to cause a lot of pain also, infraspinatus tear. Now there are other muscles around the area, which is teres minor and teres major. They give this is a synergist. That means these little muscles helped. Teres major and teres minor will help infraspinatus to do the same movement. If there is tear in the teres minor and in the teres major, it's also going to cause the same problem in the same movement. Also going to have pain right here as well. Okay? Next, excessive osteophyte, formation of the greater tuberosity of the humeral head and irregular marginated inferior aspect of the acromion, most likely the cause of patient's chronic impingement. Okay, and bone edema of the humeral head. Okay. Again, supraspinatus tear, the tendon here. Sometimes the tear could be caused by the nerve compression as well too. Now we're going to discuss osteophyte because they talk about osteophyte in the report. Osteophyte, another word, it's bone spur. Another word is degeneration. Now if you look at the shoulder here, a normal shoulder, this is a normal shoulder. There's supposed to be a pretty good distance between the humeral head, which is the shoulder here, and the acromion. This is a good distance. This is perfect. If the millimeter is low, very low, for sure there is some kind of degeneration. And we see right here, this is the osteophyte right here. And you can tell that this shoulder, compare it, this is rough, this is smooth. Rough surface always means degeneration or osteophyte. Again, same thing. Rough shoulder, a rough surface right here. Again, rough, irregular surface. And growing of the bones here. Okay, all these are shoulder degeneration. And when you have severe degeneration of the shoulder, the tendon of the supraspinatus or the infraspinatus or any muscle surrounding this area is going to get grind. When I say grind, it means because the space has been small. Every time when you lift your hand up, putting stuff on the shelf, carry boxes, moving things with your head, the shoulder, as they come up, the spaces in between gets tighter. And as you move your shoulder, it's grinding on the tendon. Imagine that. Grinding over and over again for years and years and years. Of course a tear is going to come. And if you get treatment, if you do any kind of treatment to repair the tendon without actually fixing the spaces in between, without actually dealing with the osteophyte, same thing is going to be useless. The symptom is going to come still, it's going to come back.